Well, good afternoon, everyone. I know some folks are still connecting. We'll give them a minute or two. This is Joe Kahelski at WISHIN. I've got the WISHIN team here with us, and we'll just wait a minute or two as more people join. We're expecting north of 80 participants today, so we'll get going in just a minute. Well, again, good afternoon, everyone. This is Joe Kahelski at WISHIN, and with me today is almost the rest of the WISHIN staff here. Nate Hunstiger, Laura Witter, Lisa Park, and Steve Rotman, and we got a bunch of people joining right now. How many are we up to?
We're at 36, 37.
Okay, so we're expecting a little more than 80 folks, and we're at about half of that right now. So we'll try to get the preliminaries out of the way. I was listing the folks who are with WISHIN here in the office. Keith Hogan is the last one I didn't mention. Some of you have worked with him, I'm sure. We're really happy to be able to give you an update on some new functionality that is available through WISHIN, and we're really happy about the level of interest that we obviously have. We're still having some folks join here, but I think in the interest of time, we will get going and jump in. How this is going to work is you'll be able to ask questions via the app, but the voice portion of this teleconference won't be working for the recipients. Do we open it up at the end? Or yeah, we'll open it up at the end for questions. But if there are questions as we go forward, please just kind of use the chat box, and we'll get to them as we're able to. So go ahead. We'll get started. So just kind of a table of contents of what we're going to talk about today. We'll give you a little overview of WISHIN as an organization and the health information exchange landscape in Wisconsin. Then we'll get to the meat of our presentation, which is the newly available payer access to the WISHIN Pulse Community Health Record, talk about that use case, and then talk a little bit about what's coming down the pipe later in 2018. So some of you are familiar with WISHIN, but for those who are not, WISHIN is the Wisconsin Statewide Health Information Network. We're an independent, not-for-profit organization. We are the state-designated entity for health information exchange in Wisconsin. So that means we actually have there's a reference to us in the statutes, and but again, we're not a government entity. We are a private entity. We were founded by 4 organizations: the Wisconsin Hospital Association, the Wisconsin Medical Society, the Wisconsin Health Information Organization, and the Wisconsin Collaborative for Healthcare Quality. So 2 of the very prominent provider organizations, and 2 statewide quality improvement initiatives. We've been working since 2011 to build a statewide health information network, and until recently, that's really meant providers as participants for the most part. But the news we have to share today, and what we'll be talking about primarily, is the opportunity that payers now have to access the data that we make available. Our network is made up of nearly 1,500 sites of care across the state, and we have clinical information on more than 5.4 million unique patients. So there's a lot of data and a lot of patients available through our network. Go ahead. So what we're going to spend most of our time on today is the new ability that payers will have to access the WISHIN network. We know that there's a demand for clinical information on the part of payers. We know the relationships between payers and providers are shifting, and it's more important than ever for payers to have easy, reliable access to clinical data. And because there is that demand for the data, there's also kind of an implied demand for an ability to automate or at least streamline the process of accessing that information and not require as many resources on both ends of that transaction as might otherwise be the case. I mentioned a little bit about the reach of WISHIN and the high-level information, but here's a little bit more detail on what is in WISHIN Pulse. WISHIN Pulse is what we call our community health record, and that is the longitudinal view of patients' health information. We're sourcing it from multiple locations, multiple sources, and being able to see that information in a patient-specific way. So here's a high-level kind of diagram of what is involved, what kind of information is included in the community health record. And you see, we've been in business for a while. There's a lot of data accumulating, now north of 4 million care summaries, also called CCDAs, north of 400 million ADT transactions, and you see the other kinds of clinical data there and the unique patients that we mentioned. So want to just kind of give you an overview of the WISHIN Pulse Community Health Record and the other functionality that we have available. The Community Health Record is what it sounds like. It's a way to aggregate clinical data from multiple providers about a single patient. Up until now, up until very recently, only providers had access to that information, with a couple of very narrow exceptions for payers and very narrow circumstances. But as of January 17th, January 18th of this year, payers now have access to the Community Health Record. The patient activity report until January 18th was the only way that payers could generally benefit from the data that WISHIN collects and moves. And the patient activity report is a kind of a basic kind of event notification service. The PAR, as we call it, is a daily report, and it provides basic information to payers or providers about patients' encounters in an inpatient or ED setting. So again, it's just a daily report for the previous 24 hours for a specified set of patients or members, depending upon whether you're a provider or a payer. Did that patient, did that member have an ED or inpatient encounter, admission or discharge, or a change of demographic information, and that's delivered basically in a daily report. So that was the only the extent to which payers were able to use data that WISHIN made available until, as I said, the middle of January this year. Now payers can basically access the same kinds of information for basically the same kinds of reasons as providers can. That's what's new. And just the other thing that's on this grid here is a reference to event notification service that's a little bit more sophisticated, configurable, more real-time based. It is I think, turbocharged version of the patient activity report. That's something that is coming soon, but we'll have more to say about that later in this presentation and later in the year for our clients. So why did we go down this road? Why did we look for the opportunity to provide payers with access to the community health record? Well, we know that we're in the business of moving clinical data, and we know that moving it in an efficient and real-time way offers a lot of opportunities for cost savings and efficiency, and data sharing in general. Data needs to move among providers, and data needs to move between payers and providers. We all know that. The advantage of the payer access to Pulse is once a payer connects to WISHIN Pulse, they are essentially connected to all of our participating providers. So access to the data that they're sharing with WISHIN is available essentially through one pipe. And we all know this sort of academically, but there's a lot of data out there in the healthcare world between payers and providers that suggests that, data sharing is a key to success. We all need to be on the same page, even more so now than in the past, as payers and providers are sharing risk, sharing care coordination and care management responsibilities. Makes sense for them all to be working off the same set of information. So the way the WISHIN participation agreement reads in terms of payer access is that payers may access clinical information through WISHIN Pulse for 4 reasons, 4 uses, 4 permitted uses in the context of claims adjudication, prior authorization, care management, and that's a very broad kind of category of use, and the collection of quality data. So information that undoubtedly that payers are seeking from providers now routinely in the day-to-day operations that they perform. But the access through WISHIN Pulse is an opportunity to essentially get all that information that you're looking for through one doorway, rather than having to deal with an automated and asynchronous kind of order fulfillment process where there are resources on both ends of that transaction that get used and perhaps used unnecessarily, and instead being able to access it through our network and not really bother the provider in terms of tracking that information down. So as I said, I mean, what are the benefits to providers? Obviously, there's a lot of manual work. There's a lot of phone calling, faxing, whatever, emailing, to track down information that might be available otherwise through the WISHIN Pulse system. And it's important to point out that information in WISHIN Pulse is available really as soon as it is available in the source electronic health record system. So it is very close to real time. As soon as that clinical information that's being shared by the provider exists in their EHR system, it's essentially firing off a message to WISHIN, and that is available through WISHIN Pulse. So, so it's as fresh as it could be, and it's a way to not bother with exchanging voicemails, exchanging emails, et cetera. It's a way to say, okay, if that information is there, I can go get it. Obviously, one of the things that payers need to do in terms of accessing clinical data is track down information, clinical information that's typically not part of a claim. Obviously, payers have a lot of information that comes in on a claim, but there's information like lab results is a good example that wouldn't be part of a claim, but that may be relevant in terms of documenting quality standards, compliance with quality standards like HEDIS. So, you know, that claim could tell you a lab test was done, but it doesn't tell you anything about what the result of that lab test is. And lab results are certainly a big part of the clinical information that is available through WISHIN. As we said before, this is a way for payers and providers to be on the same page and working off the same information. Again, because, you know, we know increasingly that payers and providers are sharing responsibility. They're sharing risk. They're sharing responsibility for care coordination and care management. And WISHIN Pulse can bridge the information gap that is typically something that the providers and payers are experiencing as a pain point right now. So how does it work? Essentially, for a payer to access WISHIN Pulse, they would provide WISHIN with an enrollment file outlining the members for whom they wish to have access to their clinical information. It doesn't necessarily have to be the entire population for a payer. It may be specific populations like an ACO or shared risk population, maybe Medicare, maybe Medicaid. But access is defined by when, who appears on the enrollment file. So there would be no access for a payer for a random person. They can only access information for somebody that appears on their enrollment file. So that's how we provide access, and it's a little different than how it works for providers. Generally, with providers, they have access to the community health record if there is a previous treatment relationship between the patient and that provider. Although they are able to do what we call break the glass, to the extent that they are seeing that patient and they haven't had a treatment relationship in the past, as long as they kind of document the reason that they're needing to access that information. That break the glass functionality is not available to payers. So it's really a simple matter of whether the patient appears on that enrollment file or not. If that patient or member is not on the enrollment file, there will be no access to the clinical information. So that we mentioned the enrollment file being a part of that that process. In terms of a payer that would want to participate in WISHIN, who is already a client of WISHIN because typically of the patient activity report. We're already getting an enrollment file from those payers because that's what we need to send the patient activity report. So the process of getting live on the WISHIN Pulse system would be pretty quick, 1 to 2 weeks, because again, we have those enrollment files. And even if the payer would want to add members to the existing enrollment file, that's done all the time anyway. Those enrollment files change all the time. So basically, we already have an agreement with those payers. We'd have to do an amendment, obviously acknowledging the additional service, but we can use those enrollment files to provide access to Pulse. We'd activate and train users of the system. It's not complicated, but we do need to do a little orientation to the system. Really the biggest issue there is probably getting that scheduled rather than actually executing it, just to get everybody on the calendar. But, we estimate in most circumstances, we could get this live for existing PAR customers within a week or two. In terms of new WISHIN participants, it would take a little longer because again, we don't have a member file set up. We don't have them set up as clients. We have to execute a participation agreement, although we like it when they sign the participation agreement immediately. Typically, somebody needs to review that. It's a long document. That's going to take some time. We need to test the enrollment file, obviously, to make sure that everything's coming in the proper format, et cetera. But once we're past that, again, we activate and train the users and allow you to go live. So for a payer that is completely new to WISHIN, we estimate probably a 4 to 6 week time period in terms of from the day you decide to participate to being able to go live. So the payer data use case that was approved back in September and became effective in January is articulated in the participation agreement. And again, this is the first time that payers have been allowed to access WISHIN Pulse. And it includes that list of 4 permitted uses that we went over: claims adjudication, prior authorization, care management, and collection of quality data. But also included in that that use case, in the language that's in the participation agreement, is an expectation that eventually, because payers are going to be able to access information in Pulse, that as a consequence of them being able to access that data, they will also be asked to contribute data, much the same as how it works with providers. Providers sort of need to contribute data in order to access the data. The whole concept here is it's a reciprocal agreement. It's a health information exchange. That doesn't mean that these things have to happen sequentially. And what I mean is payers can access WISHIN Pulse today, and there's no requirement to contribute any data. We're actually working through a process with providers and payers at the table to develop policies, technical standards, et cetera, around the types of data that we would be ultimately requiring payers to contribute. And so the way the participation agreement works is that once all of those preliminaries are taken care of, we work through that process, we've developed these policies, and we're technically able to do the data collection and deliver it as part of the community health record. Then from that point on, the expectation would be that participating payers would also be contributing data. That is in the future, though. That's not something that we would expect, certainly for the most part, not in 2018, perhaps very late for some aspects of that. It could be very late in 2018, but for the most part, fully implemented, I would guess at sometime in 2019 in terms of taking in payer data. Go ahead. So again, we're really excited to be able to offer the efficiencies of the community health record to payers. There's still a lot of manual work, we all know this, in tracking down information from providers. We know that payers' contracts with providers typically, include language that says, they have to be able to get the clinical information they need to do their job under the policy. And WISHIN Pulse is really an opportunity to shortcut that process. There will always probably be situations in which payers need to deal with providers, on an ad hoc basis. I need this bit of information, et cetera. But we think we can eliminate a lot of that back and forth, that asynchronous manual kind of work by providing access to the community health record. Certainly HEDIS and other kind of contractual purposes for collecting quality data is another opportunity. There's a lot of chart chasing that's going on in the payer world, and essentially what WISHIN has is, significant parts of what would be included in a patient chart. And again, access without having to physically go on site or without having to access multiple different EHRs for multiple different providers. The ability to access all of that information through a single pipe and with a connection to WISHIN. So there are any number of ways you could contact us. We have a general inbox, wishin@wishin.org. You can check out our website. You can phone us. We don't get a lot of phone calls, actually. We get a lot of email traffic. Well, we'd be happy to talk to any provider or any payer who is interested in connecting to WISHIN. We think there's huge opportunity for efficiencies, and so we have that opportunity, and we'd like to talk to all of you about that. The other thing I will mention is I briefly mentioned earlier in the presentation that we expect to have some more sophisticated notification functionality available later this year. We're not really ready to talk about that publicly yet, but we will be soon. And we expect once we are able to make that official, that we'll be scheduling a series of webinars about that functionality, about that product. And we think it's going to be a nice complement, frankly, to the community health record, where we can provide this thin layer of notification service with an embedded doorway essentially into the WISHIN Pulse community health record for the notification that goes out. And so I can't say too much more about that today, but would encourage you to watch your email, and we'll have more to say about that in the near future. So that's the end of my prepared remarks. Do we have some questions, Laura? Laura is giving me. Okay, I've got 3 questions here, and you can keep them coming. And then, are we going to unmute it at some point? We'll unmute it at some point. We'll get through some of these written questions here. So here's a question: has there been any discussion on how this access may decrease payer requests for record copies from providers? Well, if I'm understanding this question correctly, yes. I mean, and that's the intended result. We would like to significantly reduce the number of times payers are accessing providers kind of on an ad hoc basis to track down a piece of clinical information that they need to process a claim, to decide on a prior authorization request, to complete a HEDIS score or whatever. That is definitely the intention here. So the next question is, do payers see this as a HEDIS solution? I think that's the intent. There are any number of situations where we think we can fill in some of the missing information that payers might have for specific HEDIS measures, et cetera, and preempt the need to do a chart chase, to go on site, or to otherwise access individual EHRs if they have that access through the one connection to WISHIN. The next question, will there be a published list of payers with access? Yes, we maintain a list of participating organizations on our website, and payers would be participating organizations. So yes, that would be, our intent to include them in that overall list. Next question, will you have a demo when the view is available? We typically do demos for organizations that have contacted us and want to talk about participating. That's something we routinely do. We can do them, remotely. We can schedule an on-site meeting with your folks. However it makes sense for you to do. That is a very common part of what we do when we outreach to potential clients. Next question, is there a cost for providers or payers? Yes. Yes, indeed. We do have to keep the lights on. We are a not-for-profit, but we are not a not-for-revenue organization. We certainly have costs that we have to cover in making the service available. There is a cost, and our general pricing approach has been smaller clients pay less, larger clients pay more, and how we're approaching pricing for payers is essentially on a PMPY basis. So, however many members you want to make subject to the community health record and have access to their records, then there would be a per member per year fee associated with that. And that's similar to how we've done it with the patient activity report, although there's a separate cost for access to WISHIN Pulse. Are there other questions? Okay, more questions are coming in. Bear with me. Can we access a current list of participating providers? Yes. The website, wishin.org. If you go to our website, wishin.org, and then click on participating providers and go and look under Pulse, you will see a very long list of sites of care that can be sorted and filtered in any number of ways, including county, city, and type of organization, hospital, clinic, et cetera. So it's a very long list, but again, there's some filtering capabilities there. So if you're looking for a specific geography, specific type of provider, et cetera, you should be able to find, what you're looking for on the website. Are there other questions, Laura? Okay. Oh, we can't unmute. Yeah. We can't do that. I'm sorry. I'm sorry, I misled you. I guess we can only take questions via the chat function. So keep them coming if you have questions. We have some time to deal with them. Again, I think many of the organizations that are participating in this call will likely be interested in what we have to say in the coming weeks about our new notification functionality. The patient activity report will continue to be available for those who want to continue to use it, but the new service will be sort of a next step in sophistication. It will be real-time capable. It will be highly configurable, and what I mean by that is that individual users of the service can sort of express their preferences in terms of how frequently they want to receive notifications, the method by which those notifications are delivered, and things they do not want to be notified about. So we can kind of deal with the potential for notification fatigue, which we know is something that it can be a concern, particularly when you're dealing with a very large patient population. But again, when we make that available, those notifications will come with an embedded link to that specific patient's community health record. So in many cases, the notification might be all that the organization needs to know, but certainly in some cases, that notification prompts other questions about what's actually going on here, what are the clinical details, and that's where that doorway into the community health record for that patient, we think, is going to be very valuable. Next question. We will be sending out a recording of the webinar, this webinar, by the end of next week. I will make that available on the website, so folks who want to go back and see it, or if you wanted to share it with some other folks in your organization, you could do that. Are there any other questions, Laura? Okay, so we don't have any other questions. I hope to be talking to many of you in the coming weeks to talk a little bit more about how payer access to Pulse can benefit payer organizations. The question came up about a demonstration, and again, we're happy to do that. We do that routinely, and we could do it remotely, or we could meet in person with you and members of your team and do a visit that way, including a demonstration. It's very user-friendly, it's very intuitive, so it doesn't take a lot to kind of learn how to navigate the system. Again, in terms of clients who are not part of WISHIN right now, payers, we would expect about a 4 to 6 week implementation process, and the biggest part of that, the critical path, is to get that enrollment file and get that set up in our system and make sure that everything looks right. That would take probably the most time. But again, within a month or a month and a half, we could make that available to entirely new clients. And those who are currently participating with WISHIN, 1 to 2 weeks, and we could get that done. We already have 3 payers that have signed up, and we've got a couple other ones pending. So we have early indications this is going to be quite popular, and so we're hoping that everybody takes advantage of it because there's so much efficiency there that could be had for a relatively small investment and a small amount of technical effort on the payer side. So if there aren't any more questions, we will end the webinar. Again, hope to hear from you. Oh, there's another question. Sorry, there's one more question coming in.
I'll just read it.
Yeah, go ahead.
Would enrollment files need to be sent on a regular basis to keep the list current?
Yeah, and that's really up to the payer organization, how frequently they want to update. Obviously, there are changes, certainly monthly changes in enrollment. And we've dealt with this with our PAR clients, and it really is up to them in terms of how frequently they want to update the enrollment files. And the only thing I'll reiterate there is, if a member is not on the enrollment file, there's no access to the community health record for that member. So, we would think that there would be an interest in frequent updates of the enrollment file. But again, that is really, that's up to the discretion of the payer in terms of, how frequently they want to update that. But we're set up to take them as frequently as the payer wants to provide them. That's it. I guess we're out of questions for real this time. Thanks everyone for participating. We're really happy with the level of participation that we got today, and hope to be able to follow up with many of you soon. Thank you very much.